our chemistry of health assignment. For this project, we chose to look at fentanyl. We're going to go over the history of the drug, the synthesis of the drug, the biometabolism of the drug, and controversies of the drug. So for the history of fentanyl,
it was created by Paul Janssen, who was born in 1926 on September 12th. He was a Belgian physician and the founder of Janssen Pharmaceutica, a pharmaceutical company with over 20,000 employees, which is now a subsidiary of Johnson & Johnson. In 1953, he became interested in developing the most potent narcotic pain reliever possible. Together with his team, he developed the fentanyl family of drugs and a number of anesthetic agents.
So to go into a little bit about what fentanyl is a synthetic opioid that is 80 to 100 times stronger than morphine. Pharmaceutical fentanyl was first developed in 1959 and introduced in 1960s as an IV anesthetic for pain management. Because of its powerful opioid properties, fentanyl is also very commonly abused. And it's subject to international control, as are a range of its highly potent non-pharmaceutical fentanyl derivatives. So again, that illicit street fentanyl.
The study that led to the synthesis of fentanyl by Janssen in 1960 laid the foundation for a better understanding of the structure-activity relationships of narcotic pain relievers and stimulated interest in developing compounds with even greater potency and safety margins. So let's get into the synthesis of fentanyl.
So fentanyl is a piperidine derivative. That's its IUPAC name. Different fentanyl derivatives have been developed by the pharmaceutical industry by adding various substituents to the basic molecule in order to modify its potency. That approach has also been mimicked by chemists in more clandestine laboratories to produce the illicit derivatives of fentanyl. Janssen Pharmaceuticals originally synthesized fentanyl from an N-benzyl 4-piperidine, but in the 1980s, a new synthetic route became available based on the 4-piperidine hydrochloride by reacting it with phenyl bromide to give the N-phenyl ethyl 4-piperidone, which is converted to fentanyl. This is referred to as the Siegfried method of synthesis, which uses either phenylethyl tosylate or phenylethyl bromide to make the precursor. And then non-pharmaceutical fentanyl derivatives, such as 3-methylfentanyl, is synthesized illicitly, like we said, and is sold as synthetic heroin or oftentimes mixed with heroin. So to talk a little bit more about its derivatives, again, they're developed by adding substituents to modify potency. Van Beaver et al. Reported that the introduction of a methyl group into position 3 of the piperidine ring increases its potency specifically. The trans isomer was slightly more active than fentanyl and approximately 500 times more potent than morphine, but correspondingly, the cis isomer was 8 times more active than fentanyl and over 6,000 times more potent than morphine. So to go into the biometabolism of fentanyl,
So fentanyl stimulates mu opioid receptors in the central nervous system, altering the body's response to pain. Apart from being a pain reliever, the fentanyls as a group produce drowsiness and euphoria. The most common side effects include nausea, dizziness, vomiting, fatigue, headache, constipation, anemia, and peripheral edema. Within 72 hours, 75% of a dose of fentanyl is excreted in the urine. Tolerance and dependence develop rapidly after repeated use. Some characteristics withdrawal symptoms include sweating, anxiety, diarrhea, bone pain, abdominal cramps, shivers, or goosebumps, and occur when use is stopped. Serious interactions can occur when fentanyls are mixed with heroin, cocaine, alcohol, and other central nervous system depressants, such as benzodiazepam.
So to talk about the administration of fentanyl a little bit, fentanyl and its salts are normally a white granular or crystalline powder. So in a pharmaceutical setting, there's a solution of fentanyl citrate that's used for injection or that IV use of fentanyl. It's also used in transdermal patches as well as transmucosal lozenges. The illicit fentanyl normally comes as a light yellow powder. Sometimes it's called white Persian, amongst other things. It does contain that 3-methylfentanyl, and occasionally it's put on different strips of cardboard or added to other drugs as a form of use.
So similar to the way pharmaceutical fentanyls and illicit fentanyls is manipulated to alter potency, the difference in strength between heroin and fentanyl arises also from differences in their chemical structures. So as you see in the picture, on the left is a lethal dose of heroin equivalent to about 30 milligrams, and on the right is a 3 milligram dose of fentanyl, enough to kill an average-sized adult male. While both chemical bind to the mu opioid receptors in the brain, fentanyl hugs the receptor so tightly that a tiny amount is enough to start the molecular chain of events that instigate opioid effects on the body. This tighter affinity for the opioid receptors also means more Narcan may be needed to combat a fentanyl overdose than a heroin overdose.
And this is especially important as we really get into the controversies of fentanyl, as it's being laced with those other drugs like heroin. So to go into the fentanyl controversies a little bit more, there's really been a rise in the use of illicit fentanyl, and significant numbers of deaths have been attributed to these designer or synthetic, illicitly made non-pharmaceutical fentanyls. In the case of these non-pharmaceutical fentanyls, many deaths are characterized by their suddenness and have been caused by the use of heroin laced with fentanyl, with one of its more potent isomers, such as the alpha-methylfentanyl and the 3-methylfentanyl isomers. So that video just kind of shows the rise in fentanyl use and the rise in like unknown fentanyl use. So there's a lot of people that are unknowingly taking fentanyl because it's laced with other drugs that they're knowingly taking. So overdose results in respiratory depression, which is reversible with Narcan in some cases, depending on how much fentanyl you have ingested. Sudden death can also occur because of cardiac arrest or severe anaphylactic reaction. Blood concentrations of approximately 7 nanograms per milliliter or greater have been associated with fatalities, where polysubstance use has been involved. So that means they've been using the other products in combination with the fentanyl. And really what we want to hone in on here is that deaths really occur from the misuse of these pharmaceutical products, not necessarily because of their use within a pharmaceutical setting. So that's our works cited. We appreciate you listening to this presentation.
Yes, thank you.